Hello? Whoa, okay. I'm told I talk loud, so my mother always says, you don't have to talk that loud. Good afternoon. I am Barbara Roden. I am with Senior Helper, so we're one of your sponsors today. This is the reminder, if you would, to please all silence your phones during the presentation, and we would all appreciate that so it doesn't bother the person next to you. How are you enjoying the session so far? The Parkinson's Foundation has done a phenomenal job, I think, putting this together for over 400 participants. We had more people trying to come in the door today. So we can see that it's very much needed. I have the pleasure today of giving the introduction to Dr. Barbara Pickett. How many of you were in the mindfulness session earlier? So Barbara, Dr. Pickett, that gives you a little bit of an idea of how many have already seen the earlier presentation. So many of you have already heard it this morning, but she's going to present to us more in-depth look at mindfulness and its use in managing Parkinson's disease. And it's really interesting how mindfulness can play on our lives no matter what our situation. My mother thought she had dementia, so we went to the neurologist and she was told, no you don't, which I'd already told her. She just needs to be more mindful and pay attention to what's going on. So it really is something we can all practice in our daily lives. Dr. Barbara Pickett is a movement disorder specialist and is the medical director, Parkinson's and Movement Disorders at Mercy Health, Hauenstein Neurosciences. She is also associate professor at Michigan State University College of Human Medicine over in Grand Rapids. She received her bachelor's and her master's from University of Michigan and her medical degree and fellowship at University of Antwerp in Belgium. She has practiced and taught for 20 years. She is and has been involved in basic and clinical research, including her current work related to mindfulness. So with no further ado, I shall turn it over to Dr. Pickett.
Thank you, Barbara, my namesake. Thank you very much. Yeah. So we did hear a lot of these things this morning. It was rather rushed. Do you have the handheld mic?
You like the handheld better? Sure.
I won't go over everything that I went over this morning. There was technical difficulty, and it had to do with Apple. You can't hear me. Do it like, wait. Well, you can, if you want to do this, then we don't keep the people waiting.
Okay, sure.
Thank you so much. Kind of you. Thank you very much. Is that better? Yes. All right. So, mindfulness. What can mindfulness help us with in our daily activities? This is a topic that has been studied scientifically for a number of years, at least since the early 80s, with some robust literature for various problems that we face, both when we have Parkinson's and for people who aren't living with Parkinson's. So I would like to take a moment to let you all know what we have shown offering mindfulness as a training with Parkinson's. Now, when we talk about mindfulness, mindfulness was conceptualized in the early 80s by Jon Kabat-Zinn. And what did Jon Kabat-Zinn, what was his aim? His aim was to offer some relief of suffering in people who had chronic neurologic or other diseases in a hospital setting. So mindfulness was actually developed as an intervention in a hospital, University of Massachusetts. And how it was conceptualized was to use meditation together with yoga. And having said that, that's what it was. That was actually the extent of it, how it developed. So you have a concept of mindfulness. What does mindfulness mean? It means a certain type of awareness, a particular type of awareness, paying attention on purpose. We're all paying attention now to something, but it's paying attention in a particular way, in a way that helps us create space and room around thoughts and feelings. I don't know if you've ever had the experience of just getting caught up in your thoughts. I might ask one of you, like, how is your tax return coming along? Yeah? And that might elicit a change in your biochemistry. Or you might be driving down the road and it's busy and all of a sudden you look up and you see glaring brake lights in front of you. Ever had that experience? Do you know what happens in the body then? Whoo! Yeah, an explosion of adrenaline. So you're always going to have this, as I said this morning. We get this with having a body. The body reacts. Thank goodness. Otherwise we would crash into the car in front of us, right? But it's what you do with it afterwards that's so important. It's what you do with that cascade of thoughts that is so important. So, is this something that happens overnight? No. John Kabat-Zinn set up something called MBSR, Mindfulness-Based Stress Reduction. MBSR is an 8-week program. Did he copyright it? No. You know, he's one of the New Age gurus that maybe is a little bit, has his heart in the right place. So this is not a copyrighted thing, but it is something that we recognize, people who teach mindfulness. It's a standard that we recognize and respect. Now you'll notice here that we don't have MBSR. We just talk about mindfulness training and why. When we train the brain in some way, when we learn a new language or we learn a musical instrument, or as I said this morning, the taxi drivers in London, their brain area that is dedicated to the maps of the streets gets larger, measurably larger, as a function of being a taxi driver. Medical students' brains are measured before and after their exams. The brains get larger, measurably larger in certain areas. This doesn't come overnight. This is a training. And that's why, if you allow me, I hope I'm not beating a dead horse here, mindfulness is a training. It's something that you have to keep up, and it's something so you have to learn and keep up with. Okay, so let's go quickly over some slides. So our thesis is that mindfulness could be helpful in Parkinson's. It could be helpful with these, particularly with the symptoms of anxiety, attention deficits, depression, and pain, because these things have all been studied. These things have been studied by people like Kabat-Zinn and others. Richie Davidson from the University of Wisconsin, a number of scholars. And so why is this important? As I said this morning, people come to their healthcare practitioner and ask, should we follow mindfulness training? Should we follow pedaling for Parkinson's? Should we follow boxing? Should we follow A, B, or C? Should we take glutathione? Should we take mucunapurine? Should we on and on and on? A lot of these things have not yet been studied. People who have chronic diseases in general and neurologic conditions in particular go seeking help outside of the allopathic environment. In fact, one of the last publications about people with Parkinson's and complementary therapies found that 85% of people with Parkinson's seek outside the allopathic environment. So one of the things that we see here is what do people report? So we don't have a lot of studies about this, but we do see that people who follow these modalities, these are 66% of people responding to this in this study used vitamins and reported only 38% improvement. So this is an idea of what people are using and how much benefit they're gleaning. And you see yoga and meditation are not used very often, yet people seem to be somewhat satisfied themselves with how they feel after they use this intervention. So one of the things that we were particularly interested in is if people come to us and ask us, can we be helped by mindfulness, for example, we must say to them it's not been studied. So that's one of the reasons why we did study this. So you see dance and tango. There's only 4 high-level publications showing the benefit of dance and tango with Parkinson's. Whereas look at exercise and physical therapy, 1,400 publications already about exercise and physical therapy. We see here mindfulness and cognitive behavioral therapy. We have a colleague here today from our center who is offering cognitive and behavioral therapy within the Hauenstein neurosciences. We're looking at mindfulness, but you see also not very many studies being done. So I just wanted to let you know that we take this very seriously and we think that it might be of benefit. And let me show you why. So these are some of the studies again that have been done on these were not done in people with Parkinson's, these studies. These studies were done in people who had pain, in people who had depression, in people who had attention deficit, and in people who had anxiety, right? But these are things we know when we have Parkinson's, these are issues for us as well. So that's another argument in looking at this in a systemized manner. So one of the things I wanted to tell you about was this study here from Sarah Lazar, who is the one who was the first in the world to show that people who, long-term meditators, that their brains were thicker than their age-matched, education-matched peers. So Sarah Lazar looked at Cambridge, Massachusetts, at a cross-section of the population rather, and saw that people who had long-term meditated, that their frontal lobe in the meditators in the 50-year-olds was just as thick as the 20 and 30-year-olds in that population. So this was very spectacular in the time. But of course, who can meditate long-term? Who, for some of us, what is long-term anymore, right? We want results and we want it now. So let's see if there's another way of going about this. Later on, Britta Hülsel, then at Gießen University in Germany, now at Harvard, showed that after 8 weeks' time now get this, she calls it a normal, healthy population, after 8 weeks' time that the brain measurably changes in volume. So that we don't need to be long-term meditators. We don't need to go to the Himalayas. We don't need to join whatever newest New Age guru movement to have some health benefits of these kinds of interventions. So after 8 weeks' time learning to meditate, and we're going to do a little bit of that in a moment. Yeah, I think everybody's saying, when you're going to be quiet and so we can meditate together. Let's get to it. After 8 weeks' time, the brain changes in normal population. Now, I would beg to ask you, what is a normal population of people who are seeking stress relief? So whether these were normal people or not, I don't know. But in any case, what has never been shown is, okay, if we have Parkinson's, can our brains change as well? We would like to know this. So we will answer that in a minute. What is mindfulness? Now you see here, mindfulness is the awareness that emerges through paying attention on purpose. Just pause there, stop reading. It's an awareness that emerges through paying attention on purpose. Close your eyes for a minute, if you will, and just listen to the words. It's an awareness that emerges, comes about, grows. Think about something spacious, emerges through paying attention on purpose. So what might you pay attention to now? You might choose to pay attention to your breath. The breath is something that we always have with us when we're here walking around on this earth. So if you follow the breath from your nostrils, if you so choose, or if you're breathing through an open mouth, that's fine too. Notice the temperature of the air. And trying to keep your thoughts just on the breath. Just on the breath. And see if you can follow one full breath, breathing in. You might feel the temperature going up through your nostril, going up to the back of your throat, going down the throat. Sometime, at some point, the temperature of the air will change and it will become imperceptible. And then breathing out. And try that again a couple of times. So you can open your eyes, or you can continue with whatever you're doing, but I would like to ask, is there anyone who had no thoughts while they were doing that? Probably not. It's the work of the mind to generate thoughts. It's the work of the mind to generate thoughts, and it's possible to have that thought machine going while you create this space around them. And why might that be important? One of the reasons that we got led to this work was that, I've been serving people with Parkinson's for more than 25 years. And what I hear consistently is, or the first symptoms came when I was in the bank, I had to sign my name, or something very stressful happened, or I'm in the line at the grocery market and there's a whole line of people behind me and an unfriendly cashier and some unfriendly people behind, and I have to get my change. You know the scenario. In other words, more stress, more symptoms. So if in that moment of acute stress, whether that's an unfriendly cashier or something more serious, if we have the ability to see my body is reacting a certain way, and not to get caught up in the cascade of thoughts that comes with that recognition. Recognition that is built on experience, right? And those are the things that are also important in cognitive behavioral therapy, right? Karen at the back, right? Where they're very similar techniques. Mindfulness is somewhat more in the soma, somewhat more in the body. So when we practice mindfulness, we learn to recognize things coming up in the body, because body and mind, as we heard this morning, and as we know from the big and loud therapies, that the mind affects the body and the body affects the mind. I mean, yeah, it makes sense. We've been taught to live outside our body for many, many, many years. In fact, one of the first exercises that we do in mindfulness. Now, I'll ask you again, if you would like, to close your eyes. I promise I won't surprise you with anything, but if you just close your eyes and bring your attention to your feet now. Bring your attention to your feet. And if I were to ask you all, how many of you now do not perceive your big toe? Do you feel your big toe? Many, many, many of us adults do not feel our big toe any longer. So you can open your eyes again, because I want to, probably everyone in this room has seen a baby suck on its toes, right? What a party! How wondrous. Laying on you did it, all of us in here were babies. We all laid on our backs and sucked out our big toe. And what wondrous that was. We don't remember. But as we grow up, we become divorced from this body, and we stop feeling things. And part of mindfulness is rehabilitation. What does that mean? To live again within the body. The body is a friend also when we have life with Parkinson's. It's rehabilitation. It's getting back within the body. It's learning to accept the feelings and learning to accept what's happening to our body. It's not a secret, we're all going to get something. So mindfulness is not putting on a rose-colored sunglasses and seeing the world, happy. Mindfulness is seeing what there is. Seeing what there is. And I'm not saying accept. I didn't say that word. It's not acceptable that we get Parkinson's. It's not acceptable that we get sick. But it happens, right? So this is a way of helping us carry what's presented to us, what life has put on a platter under our nose. It's a way of helping us carry this, helping each individual carry it, and it empowers us in disease when we have a problem. This empowers us, puts the center back with us, takes a little bit of the burden off the caregiver, takes a little bit of burden off the healthcare provider, gives some room so that we can give something back. So, MBSR, Mindfulness-Based Stress Reduction, is a program. Again, it's not copyrighted, but those of us who teach it respect the structure of it because it's replicable. We know pretty much what is given in which session so that we can communicate about it. It also makes it very nice to study, something that can be repeated. It consists of 8 weekly group meetings of 2.5 hours. So the same group, the same group comes together for 2.5 hours once a week for 8 weeks. Yes? People receive a formal training in the body scan, mindful meditation, and mindful movement. So what is the body scan? Well, we begin with either sitting in a chair or typically laying on the ground on a mat in Savasana, which is a dead man's pose, which is laying on your back with the chest open and the palms up and the legs falling like an open book. If we had more room and mats, we could all do it together. But we can do it in a chair. You can do it standing up. And what is this? What is this body scan? The body scan is like, we know where do anybody know where we begin the body scan? What do you think? The big toe. Yep. We begin with the great toe, the big toe of the left foot. It can be the right foot too, that much of a stickler we aren't. So we bring all of our attention to that left big toe. And even if you don't feel it, it's still mapped in your brain. The sensory cortex still has a place for a big toe, but it's not getting any information. So if you bring and this has been shown on functional MRI, if you bring your attention to your left great toe and just pause there. You can do that now with me if you'd like. So just bring all your attention there. I'm not asking you to imagine. I'm not asking you to make something up. Just bring your attention to that space if you don't feel it. Imagine the contour of that toe. You've certainly looked at it before. Imagine the space between the big toe and the next toe, toe number 2. Imagine the space there between. And if you'd like, if it makes sense to you, bring your breath there. Feel your breath going in your nose to the back of your throat, where at some point the temperature change makes the breath imperceptible, coming down into the lungs, and let it follow down. Let it follow down all the way to your great toe. Bring your attention then to all your toes, however they are, and without moving, you can wiggle them, they're your toes, you do with what you want, but you don't have to, just let them be, just see, feel. This is called interoception. This is a sense that we have. This is a neurologic phenomenon that we can do this. So feel how it goes. Feel then, where's your foot putting pressure on now? Those of us who have our feet on the ground, where is that? What parts of my foot are touching the ground? And again, if it makes sense to you, if it's a mental construct that is acceptable, bring your breath there. Breathe into your foot. And then follow your breath now 2 or 3 times and try to keep your attention on your breath as it flows in, as it turns around. That point of turning, what is there? Paying attention on purpose. And then breathing out again. And then I would invite you back as a group. So this is the way we begin the body scan. And people are laying or sitting for 45 minutes. We do a Jules Verne through the body. Okay? 45 minutes. We go from the toes to the foot, to the calf, to the thigh, etc. Up the whole body. So it's a sensory rehabilitation. It is a sensory rehabilitation. We are retraining the senses. We are feeling what there is to feel, not wishing things away. If there's pain, we say, that's pain. We recognize that that's pain. And instead of, we've all had this, or maybe not. Anyone ever hung up a picture on the wall and with the hammer hit the wrong thing? Yeah. Does it help that we scream and yell and whatever? Probably not. Maybe some, but next time something little like that happens to you, see if you can pause and just feel what that pain is instead of reacting, which is another very important construct in mindfulness training, is to learn the difference between reaction and response. So I'm hammering on my thumb instead of on the nail, and the reaction would be to yell and maybe throw the hammer. I'm sort of not a very calm soul, so I would, get all excited about it. Whereas if I would think, what actually, you don't even see anything on that thumb. It's not bleeding or anything. And actually, what is the quality of that pain? What does that pain mean? What does pain mean to us? And giving there some room, some attention, some room around it is going to make my experience of having that pain very different. Okay. You can say the same thing for the pains we have when we have Parkinson's, for example. Many of us here in this room might have begun our Parkinson's with pain in the shoulder, or pain elsewhere, pain that couldn't be alleviated by some sort of physical aid. Right? Like not hitting yourself with a hammer would be, but we don't always know how to help when we have Parkinson's and we have pain. We don't always know how to help people when we have cancer and we have pain. We don't always know how to help each other when we have deep sorrow or depression and pain. So mindfulness is a way of not pushing that pain away, seeing it, not cramping up from it, giving some room around it, and somehow in that it makes it less painful. I don't want to say acceptable, because some things are not acceptable. I'm a physician. For me, it's not acceptable that we have Parkinson's, but it takes some of the ache out of it. So that's body scan. So we've just done some body scan together. Mindfulness meditation. MRI, I will show you some. Would you like me to, I will show you, I'll show you MRI scans. They're coming. Okay. Mindfulness meditation is a meditation without a mantra, without a Buddha, without incense, without a collection pot. Mindfulness meditation is on the breath. We learn first following the breath in and out, and then we learn open meditation, and that is not having the breath, not having anything, just giving space and watching thoughts as they come, and also watching thoughts as they pass. Thoughts as they pass, like clouds pass. Okay? This takes practice. Mindful movement is like yoga. Is yoga using a mindful attitude? So, someone asked for MRI. Well, here we go. We looked at people, and I showed briefly the slide this morning. We looked at people who were living with Parkinson's, and we asked them to participate in a randomized, controlled, longitudinal study where we used inclusion and exclusion criteria that we use when we do pharmacological studies. So I've been doing pharmacological studies since 1992, including ropinirole, mirapexine, the Nupro patch, Duopa. Those are all studies that we've been doing since 92. So we use the same inclusion and exclusion criteria to look at what mindfulness might do to the brains of people who have Parkinson's. What did they do with my, what have they done with my slide, Mom? No, I'm serious. Well, dagnabbit, those guys this morning, it was there. Did some of you see it this morning? You saw it, yay! Oh, and I wanted to show this lady here the MRI. Well, I might have it somewhere. Yeah, you saw it this morning. Okay, so what did we show? We showed that after 8 weeks' time, the brain gets measurably larger. But not the whole brain. No, more importantly, specific areas of the brain where memory is stored, where dopaminergic medication has its action. That part of the brain got larger. Okay? We see when we have Parkinson's, and when we have Parkinson's for many years, we start to lose more brain cells, not only in the basal ganglia, but also in the occipital cortex. That's one of the areas that has atrophy when we have Parkinson's. We showed in our study that that area also grew in gray matter density. And that had not been shown in normal populations before. So this is interesting. The other thing we showed, and for me, and John Goodrow this morning agreed, and I think that this is probably one of the most important findings in this study, and that is when we have Parkinson's, but most of us are right-handed, most of us have Parkinson's then, or majority will have Parkinson's that began in the right hand. If that's so, our left cerebellum corrects for the motor deficit. Okay, you with me? So when we have Parkinson's, let's say we have right-handed Parkinson's, the left cerebellum corrects for the motor function. So what did we see? In our study, we saw that people who had the mindfulness training, half of the people went through the training, half the people waited. They got it later. But half the people waited. And we compared the brains of those who had the training against people with Parkinson's who did not have the training. And we showed that their cerebellum in those people who had the mindfulness training had to work less hard than those who did not have the training. So after the 8-week study, the cerebellum half was larger in the people who did not have the training. So that's unique, that has not been shown yet. So it's doing something. What we don't know is how long will that last? Because it is a training. So we have plasticity. We talk about brain plasticity. We also have negative plasticity. So if use it or lose it, to coin a popular term. So these kind of things need to be practiced. So yes, so these were the results. So we had the amygdala. The amygdala is the seat of emotion, is the seat of fear, if you will. It's also something that changes when we have Parkinson's. Not only in Parkinson's, but also in post-traumatic stress syndrome. The amygdala changes, becomes more reactive. This has been shown using mindfulness that the amygdala is also impacted. The occipital lobe I spoke with you about. The cerebellum I also spoke with you about. And I would like to, maybe if we have time at the end, show you this image because it's a beautiful image of the cerebellum where we show the dentate nucleus. It's very, very beautiful. So what? So you say, so what, Barbara Pickett? Big deal. My brain has changed. What does that mean? Well, we also measured the Unified Parkinson's Disease Rating Scale. Ever had to do this for your doctor? Yeah. We measured that. We measured a number of what we call neurobehavioral measures or scales. Oh no, they stole these too. Wait, I'll look this up. I will probably get really embarrassed because you guys will see my whole desktop now. But yeah, that's like really weird. Okay, let's look here. In the interim, are there any questions up to this point? Aha! Where do you get the training? I'm sorry? Well, we're thinking about doing that. Do you think that would be helpful? For what are you talking about? Well, but who's giving it? Is that Karen? Is that Karen? Karen, who's giving it? Mm-hmm. Okay, but I would like to check with you before we say that because University of Massachusetts with the Center for Mindfulness, that's the center? Okay, then I would like to take a look at it with you, and what we could do is put that out in the next messenger, and or stop by the Hauenstein and we'll get you some information. As far as I know, the University of Massachusetts Center for Mindfulness, which is where it all began, that doesn't mean that they're the last word on it. Please understand me well in that. But that they've always charged for their training. So I'm surprised. And that's good, if that's the case. Very good. The other thing is, online is different than being with people. There's something particularly nurturing about doing this in a group. Whether it's just like instead of one potbelly stove, you got like a bunch in a room. I don't know what it is, but there's something precious about the group. So yes. This is what I wanted. These are the slides. These are the changes in the brain. You see, they didn't steal them from me. And you see really beautiful here, the hippocampus. I'm tickling this hippocampus here. Remarkable. Also, you see here, and you don't see this very well, but this is the dentate nucleus. If you come closer, if you want to look at my computer later, you really see the dentate from teeth, you really see this tooth structure here. So these things do change after 8 weeks in us human beings. So I want to show you now the neurobehavioral effects that we found in this study, okay? In this study. What did we find? We used a blinded rater. So we used a professor of neurology, the head of our department, who was a movement disorder specialist, and he rated the people who were participating in the study, the people with Parkinson's who were going to follow the mindfulness training. He rated them before the study, all the people, all 30 of them, and after the study. The same rater rated the people who participated in the study. Now, he did not know, and people were told not to tell him whether they had followed the mindfulness or not. Now, problem is, what's the problem? What are the scientific minds here? The people who had the training knew darn well that they had the training, right? So there's an element of motivation in this. There's an element of placebo effect in this. There's an element of that there. That is really hard to filter out. Be that as it may, the people who followed the mindfulness training after the 8 weeks' time had a 5.5 decrease in their motor score. And this is published in the literature when we're doing drug studies. This would be on the front page of most journals if we were to show this much difference in change of motor score. This is considered a moderate to large change in UPDRS. Okay, so the people who followed the mindfulness training improved. The people in the control group worsened slightly. You have to imagine you're going to participate in the study, and then you don't know yet. You know, you have all these tests, and then the researcher comes to you and says, you got to wait 2 months. And you can do it now. So there is this motivation thing that's rubs against everybody a little bit. So, but anyway, this is what we found in this study. What else we found is that the people who followed the mindfulness training increased in their observation of bodily pain. I didn't feel so great when I got that result. I thought, whoa, people are reporting more pain. But actually the pain is there. People are realizing that they have pain and reporting it. The people who did not have the training decreased in their reporting of pain. So interesting. This is just one study. You know, we have to be very careful how we interpret this. We did a number of studies. We did the Beck's Depression Inventory. We did an anxiety scale. And these are the only relevant things that came out, statistically significant things that came out of the study. This last element is the 5-Facet Mindfulness Questionnaire, which is a questionnaire that's used in cognitive neuroscientific research. And we saw that after the 8 weeks training that the people who had taken the mindfulness increased significantly in their capacity to observe. So observation is a part of the mindfulness training. So just want to close by saying, and then I'll see what you all want. From this one study, we have indications that there's trait-like changes. That is, changes that last longer than the act of. So when we meditate for some time, we train the brain for some time, the certain brainwave activities that change are stable and are present when we're not meditating, that the brain acts differently outside of meditation. We're currently performing studies at the Hauenstein now. We've just completed a group of people with Parkinson's with mindfulness training, and we're looking at focus group outcomes just to see that there are things that perhaps we've missed. Voila. That's another talk. I wanted to leave you with that and ask you, who is the physician and who is the patient in this picture? Thank you. Are there any questions? Yes, please.
The people in the study that self-reported increased perception of pain.
Yes.
How did they report it?
Yes.
Doctor, would you repeat the questions since our other again?
Yes, I can.
Thank you. So when they reported that, because they somehow indicate that that was a negative to them, that they wish they hadn't gone through it, or that, you know what I mean? Or
I certainly do know what you think. That's a very good question. So the question is, the people in the study who reported an increase of pain, did they experience that as in a negative fashion? My sense is no. This is a group reporting. So in other words, we did not bring it back to the individual. These were reported on a group level. We have met with these people afterwards for, yeah, I'm trying to think of how like reunions. In fact, this study was done in 2012, and the people in this study are still coming together as a group to meditate. So I guess for many of them, the answer would be no. It didn't. It did. Some people dropped out. We had some dropouts. Meditation is not for, or this kind of training is not for everyone. And very interestingly, we don't know, there are some people who are suggesting that certain brains may have a proclivity to meditation or spirituality. That's one thing. We will want to look at this also looking at brain-derived neurotrophic factor and seeing, is the brains that change, is there some genetic background to that? There's a lot of unanswered questions, a lot of fascinating things going on as far as this goes. Yes, please. Do I believe that mindfulness assists the medications in terms of how well they're working? That's a very interesting, this is pure conjecture. I have no data to base this on. I try not to use the word belief when I put my scientific hat on. So I'm trying to be, if I was sitting in an exam now and you were my professor and you asked me this question, I guess I would dare to say, did you hear the question? Is that what you said to no. I thought she said repeat the question.
There's a question back here.
Wait, I have an answer. I'm giving a long-winded answer. Excuse me. To answer your question, if we are active, we use more dopamine. You know, when we have to sometimes take an extra dose when we're particularly active. You might, that the brain uses a lot of energy. So you could say that this might have an impact on metabolism in general, including Parkinson medications. So if you're fraud and uptight, I don't know. Very good question. That's something maybe we should consider. Yes, please.
Oh, I have a mic back here, so I can walk up to her next if you don't.
Go ahead, please. You.
How long, oops,
Hello.
how long, how often should you meditate?
How long and how often should you meditate? I think that it depends on who's asking. Who's a wonderful voice there? Thank you. Nice to meet you, sir. One can begin with one breath. One can begin with one breath once a day, just to have the experience of what it is to come to oneself. I think to effect a change, what seems to be the going bargain here is maybe twice a day for 15 minutes. Something that's acceptable. I think it depends on a whole lot of factors, but when we learn mindfulness, we have people meditate 45 minutes a day, 6 out of 7 days a week. That's what was in this study. That's pretty intense. Some people find that difficult, and then we suggest not in MBSR, because an MBSR is MBSR, and that's 45 minutes 6 times out of 7 a week. But twice a day for 10 or 15 minutes can already change some physiologic parameters, cortisol, stress hormones, things of that nature. Are you the master of ceremonies with the microphone? Okay. Yes. I think that's a very good question. To give you a practical answer, some people, when they learn that body scan, going up that Jules Verne of the body, fall asleep. They begin with the toe, and then the next thing, they're at the right hand, and they think, oh my God, the rest of my body's gone. So I would say the time that you are most awake. We don't want to fall asleep, we want to fall awake. We want to feel what there is. So practically speaking, if you want to fall asleep, do it in bed at night, pull the covers up, have your hot rum toddy, and you're gone. And if you fall asleep, do it on the cold kitchen floor. And the point is not to fall asleep. Is that an answer? Thank you. Yes?
Did these people who were in the study feel that it made their Parkinson's progress slower? Or did they feel there was a benefit to their Parkinson's as far as feeling better?
Thank you for your question. It was an 8-week study, so I don't think we could say anything about disease progression. However, I wish I'm going to ask Susan Wallner, who's our go-to woman in the Hauenstein Neurosciences, to tape some of the responses that people had when we did it here in Michigan. Yes, I think that people really got something out of it in terms of being able to control symptoms and moments that were difficult, including tremor to some degree. But I want to be very careful. These are still anecdotal things. My sense is yes, otherwise I wouldn't be going on. I mean, I've been in this business a while, and it seems to give something, some small thing. Thank you. Yes. Oh, sorry. Okay. Where is it available? Right now we're offering this in the Hauenstein Neurosciences in Grand Rapids. I was speaking with the people at University of Michigan this morning here, saying we should partner. If we could maybe use the Michigan Parkinson Foundation is Deb? Deb came here through here. Okay. I will ask Deb Orloff if we can in some way use the foundation to get some communication to you all about that. Yeah, what part of the state are you from? Right here. Okay, yeah. The UP. And the UP, the Uppers. Yeah, the Uppers. Okay.
Question over there, Doctor.
Where?
Got answered the same one. One more question, maybe? Okay, where did you go to? You've been waiting. Can I go over here first, and then I'll walk back to you? Can you talk loudly?
I can really talk loud.
Really loud?
Yeah, big and loud, big and loud.
This is sort of an observation, but I'd be interested in your opinion on it.
Thank you.
What you're talking about is there's nothing special about mindfulness-based stress reduction. It really is the output of 2,500 years of yogis.
As old as the streets.
Teachers and all
Yes.
that kind of stuff.
Yes.
So the idea that it's the only package in town that's viable is only useful scientifically. It has that value. But you can find this in most yoga studios, many other places where people teach meditation. Would you agree with that?
I would agree with you, dear sir. The essence is the same. Caveat emptor, there are a lot of New Age gurus out there that want to get in your pocket. And that's the problem I have with it. And that this is a tried and true and well-studied something, whereas some of the other variants, like, are we going to use a mantra? Is it going to be Coca-Cola or one, or is it going to be something really difficult? What are we impacting? What parts of the brain? On and on and on and on. That's why, indeed, scientifically, this is nice because it's very standardized. But the essence of it's all the same. The essence, thank you very much for your question, because I have an allergy to New Age gurus. Thank you.
So we have one last question. And
Yes.
I just want to remind anybody that needs credits for continuing education, CMEs, be sure you get to one of us with red shirts so we can give you an evaluation. You must fill out an evaluation and turn it in. Last question?
Yes, at different times in my life, I've been involved in the Alexander technique for musicians and other people.
and the Lamaze technique, of course, for childbirth. Are there things that are the same principles in these things, what you're talking about?
The last part of, are the same things?
Are there similar properties in these things?
Are there similar properties?
Similar properties.
I honestly could not, I mean, I'm aware of those techniques, of course, but they have not been studied in this way, certainly not in people with Parkinson's, so I really don't think I can give you an answer to your question. Very good question. If you find something out, but the problem is, and that's even with drugs, people don't like to compare in the same scientific paradigm. It's unfortunate. We should do more comparing. Thank you for your attention. Thank you, thank you.